Cancer screening is essential. This year, several organizations in the community are partnering up for the Nebraska Physicians Cancer Screening Initiative. Joining me today to tell us more about this project are Dr. Bob Rauner from Partnership for Healthy Lincoln and Dr. Mike Rapp from the Physicians Network. Thank you both for joining me today.
Thanks for having us.
All right, well, let's get started. Tell me how the idea started.
Okay, well, it's actually part of a national effort called 80% by 2018 to get 80% of people screened by 2018. And then Ali Khan, who's the new dean of our College of Public Health, was looking at some measures where Nebraska kind of falls behind other states, and colon cancer is one of them. We have more colon cancer in our population than other states, but at the same time our screening rates kind of lag other states. And so we started talking about how maybe we could make a difference locally or even regionally, and so Mike and I were both on the County Medical Society board and started talking a little bit how could we create a project that might do this. So
Bob presented it to me, and my organization, the Physician Network, which has a large number of primary care doctors involved, enthusiastically embraced it. They thought it was a great idea, and so we decided to partner up.
All right, so what's the purpose of the project?
okay, well, one of the things we do is we take, one, to solve any problem, it helps to measure how good or bad you are on the problem. And most of our clinics in town have an electronic medical record system where they could actually pull that out of their electronic medical records and see where they're starting. And so we came up with the idea of trying to get as many of the systems in town to cooperate on this, and as many clinics as possible cooperate. And we have a majority of the primary care physicians working on this project, from One Health, the Physician Network, some of the safety net clinics like the Family Medicine Residency Program, People's Health Center, Urban Indian are all working on it. And so we basically got some grant funding and started the project about 4 months ago. And now the clinics are starting to put their polling measures, and they're seeing, okay, how good or bad are we on this, and what could we do to fix it? And so we've been going around, both of us presenting the clinics, here's how the project's going to work, here's how it's going to happen.
And you mentioned a few people that are involved in the project. It kind of sounds like it might be statewide even.
It has, TPN has clinics in Nebraska City, Kearney, and Grand Island, and once they heard about it, there have been clinics in each of those cities that wanted to join in.
Very good. So how exactly does the project work?
Okay. Well, a couple of things. First they pull the measures out, and then we talk to the clinics about how they could do this differently. They're getting the results that they get right now because of what they're currently doing. Well, how are we going to make it better? And so it's a kind of a systematic way to take a look at things and change, even, for example, how the clinic is staffed, how we can have better reminder systems. Some of the clinics have care coordinators, for example. Could they get involved in the effort? Can we bring in the front office, get them involved? The Physician Network has a system of care coordinators, for example, already that they use.
And one of the major things we found is that our doctors are doing a great job already, but putting the reports in different areas in their computer system so it's not easily retrievable. So that was number one thing we began to work on, is to standardize exactly where those reports go. You would think a computer system would have that built in. Guess again, you have to be sure it's there. And that's one of the major things Bob taught, is getting it in the right place so you can retrieve that and be able to defend what you're doing.
Okay, now what else have you learned in the project?
I think one of the biggest obstacles, unfortunately, is electronic medical record programs. Most doctors' offices have a program that's going to work, but most of the systems just are very badly designed from the start. And so you give somebody a badly designed product, and you don't. And a lot of the EHR companies didn't train people how to use it correctly. So one clinic, for example, had been using this program for 10 years. We went to pull the measures, and their result was 0. And the problem is that the way the system was set up 10 years ago was wrong, and they never really fixed that issue. And so by pulling the measures, you could find out what was wrong about the system. And so the big portion, the first 3 months, is honestly cleaning up the data.
Yes, it is.
And so we're fixing the electronic system so they work better, so that they can give the reminders at the right time. And so I think the fact that, like Mike says, is that they pull the result and it's not there. Well, it's just because of the structure of how things are set up, and now it can be given to the front office when someone checks in for their office visit. It can say, you're due for colon cancer screening. When the nurse takes them back to the room, it can say, you're due for colon cancer. So it's a system of reminders that actually helps in getting the system set up properly in the first place. And that's, I think, one of the most surprising things is is how badly a lot of them are set up, and you'd think they would ship that way. It's not as easy to use as your iPhone, you know?
Sure.
So.
So how is the project funded?
Well, we got grant funding from a number of organizations. Blue Cross Blue Shield Nebraska is funding a chunk of it. Copic Medical Foundation, which is Copic is a malpractice carrier. The Nebraska Medical Association liked the project, and they're funding it with their foundation. And then Catholic Health Initiatives is providing some of the funding.
Right.
Okay.
Now, you've said that you've kind of worked with these clinics to take a look at their databases and that sort of thing. What's next for the project?
The next thing is to show how we are improving. So again, you run those same metrics. You get the data back out in a couple of months, and you see if you've had an improvement. If you've had an improvement, great. If you haven't, then you need to reevaluate your system in your office and see what's not working. Because with everyone paying attention to it, obviously it should improve.
Mm-hmm. Are there certain time periods that you'll be checking in on the data? What's that set up?
Most of the clinics pulled their baseline data in February and March.
Okay.
So this kind of told them they are, and say maybe they're like at 42%, for example. They've been making some changes, cleaning up their systems, doing some better reminders, and then so about the next month or so, July through, probably by the month of July, everybody will pull their measures again and see, did we make a difference? If we made a difference, obviously we're in the right direction. If we didn't make a difference, we need to go back to the drawing board. And each clinic has basically created their own process sheet. And part of the reason why is each clinic, they have got different resources, different sizes. So a 1-doc clinic is going to be a little different than a 12-doctor clinic as far as the staffing. And so, a lot of what Mike and I have been working on, honestly, is they take their plan and they create their own plan. So it's not us imposing it on them. It doesn't. I don't think that fits well with the mentality of most Nebraskans to have things imposed on them. And so we're working with them to create their plans, which has been kind of an interesting process.
It's very interesting. As Bob was saying, a single physician or 2-provider clinic, the front desk may have more to do. If you've got 12 physicians and the front desk is just maximally busy all the time, then it's other resources in the clinic that have to be paying attention to this.
So what can a viewer do if they feel like they should be getting screened?
People most appropriate for this are people between the ages of 50 and 75. And so if you haven't had an annual wellness visit, well, you should go into your primary care physician's offices and get your annual wellness visit. And while you're there, one of the things you learn in quality improvement is to have multiple checks, okay? So it's not just one person's job to get this done. So we want the front office to think about it, the nurse to think about it, the doctor to think about it. What often is forgotten is why not the patient? So if your doctor or nurse forgets to ask you, you should ask them, should I get screened for colon cancer, and if so, how? So I think the biggest thing is that patients themselves can be one of the last check to make sure something got done.
Right, very good. Well, thank you both for coming on today and telling us about this important project.
Okay.
Our pleasure.